Thank you for this nice introduction. Actually, you would question why is a surgeon telling about home VR for post-COVID symptoms. So I tell you a little bit of my journey and how I came involved in post-COVID complaints. I was started training in general surgery, and in the Netherlands means you do trauma, orthopedics. I did a fellowship in vascular surgery, and I did my PhD in surgical infections, abscess formation, so dirty stuff. So you can easily understand that my nickname at that time was Dirty Harry. But then I started to do major surgery, preliminary liver resections, pancreatic resections, and I was a frequent customer of the blood bank. And although I consider myself as, let's say, a blood cell chaser, they started to give me another nickname, which was Bloody Harry. And well, actually, you could imagine what is the female variant of this jacket. This is called Bloody Harry, so the female variant is Bloody Mary, yes. Actually, you can still buy it on the internet. 10 years ago, my life and my professional life changed. And this is because I had the opportunity as the first surgeon in Europe to wear the Goor glass. And I tested this Goor glass for its use during surgery. And this was beside, let's say, I don't know if people remember, it was like, hey Google, and you tick the glass and said, take a picture. And then it took a picture. So we tested it beyond this taking pictures. And this is a broadcasting of this testing. So you do remote video streaming, but we had some advice, remote consultation through Google Glass, which is very efficacious for residency program training. And then 10 years ago, already 80% accuracy with transcription. So during the operation, we did the OR report immediately. So from that time on, I was, let's say, infected by DIF. And DIF is the Digital Innovation Virus. And this is a very unique virus, DIF, because you can't develop any resistance to this virus. And also there's no vaccine and there's no therapy. And like other viruses, there's also a post-DIF syndrome. These are typically symptoms of people like a little bit crazy, disruptive, full of energy, and actually I'm at the moment now a chronic innovator. And as all viruses, it affects most the elderly people. And so this is me when in 2019 I was asked as a surgeon to be the chairman of the Department of Primary Care and Community Care. So I don't know how it is in the US, but in the Netherlands this is quite unusual. A surgeon leading general practitioners and community workers. And at that time, we were discussing with the whole group about the future of primary healthcare. And we talked about what is now the talk of the day, the broken healthcare system, and how we could fix this. And then we were inspired by these two books. And on the right side is in Dutch, but it's called Physician to the King. And this is a history telling of about 1800, where at that time hospitals were hospices. So these were places to die. And at that time, physicians were going to the homes to treat the patients. So actually, 200 years ago, we already had hospital at home. And based on these books, but also the thinking we did with the whole group, with the GPs, we came to a fix. And the fix is, the future of healthcare is educating patients, educating citizens to take responsibility for themselves, to do self-management as much as possible. But then, 24/7, supported remotely by physicians or by nurses on a distance. And then, on demand, remote counseling by a virtual expert if this is needed, And then, which is done in the UK during the COVID, outreach teams, which means that people going physically again, like 200 years ago, to the patient at the home and treat the patients themselves there in the homes. And then only last but not least, when it's absolutely necessary, obviously, admission to the hospital. We call this remote care with a human touch. And then COVID came, 2020, completely locked down, but I tell you in the Netherlands, this is called by our Prime Minister an intelligent lockdown, but it was a complete lockdown. And you see here a typical picture. Most people forget this is real pictures. It's not a graphic or whatever. It's not painted. And this is quiet cities, clear skies, and also ripless water. No boats on the canal, completely locked down. And at that time, we happened to be busy developing an interactive online course on post-infectious disease after Q fever. And we thought, we immediately took COVID in it, because we were anticipating that this virus was also going to give post-infectious symptoms. And in the slipstream of that, we developed a VR program to treat patients at home for post-COVID symptoms. So in the late 2020s, we started already to include these patients, and we also made a research project out of that. Until then, we only had experience with VR in the hospital, and this is a typical picture of what we see as our virtualist service, like we copied from Cedar Sinai. At first, we did the first session of training at the physiotherapy practice, because we were a little bit afraid about the side effects and about complications. But then, quite quickly, rapidly, the patients started to do this at home. And from the beginning, we were not only focused on physical exercises, but also on mental and cognitive exercises. And you see here
we're in the ancient temple now.
All
and it's a
examples
great place to practice
of our app store, which we have on the platform, which combines physical, mental, and cognitive exercises. So concentration exercises, focus exercises, memory exercises.
To fit correctly in the gaps.
And what we also did is to develop a full service and support system to bring the headsets at home, to clean them, disinfect them, and to also do remote counseling from a distance, to include wearables monitoring when needed and when necessary. And this is a video on that, how this looks like. Maybe sound?
Since the outbreak of COVID-19, data indicates that 5 to 20% of all people infected with COVID-19 seem to experience lasting physical, mental, and cognitive complaints. These are referred to as long COVID. This adds new layers of complexity and cost to pre-existing healthcare challenges. A new model of care is needed to help these patients. This approach is multi-domain, home-facilitated virtual reality rehabilitation via virtual connected care solutions. The approach starts with an order from the patient's healthcare provider for a virtual reality toolkit. Based on a patient's needs, the toolkit is prepared in a local virtual connected care center. The toolkit is distributed by a sustainable transportation service and delivered directly at the patient's house.
It's Holland. We like bikes.
The toolkit consists of a virtual reality headset, a smartwatch for measuring vital signs of patients during virtual reality use, and a tablet for telehealth consulting.
Hey, hoi. Hi.
The For a Healthy Me remote care telehealth platform moves the center of care beyond the walls of the treatment center. Using the virtual reality headset and the accompanying smartwatch, the patient also receives support on what game to play, at what levels, and how often. A set of games developed by SyncVR Medical is installed on the headset. Games include physical exercises, relaxation and breathing exercises, and games for cognitive training. The games are appealing for users. They are fun and motivating patients to rehabilitate. All games can be personalized to individual needs and abilities. The integrated solution equips the healthcare provider with clinical applications, video analytics, and data into the use of virtual reality and into the vital signs of the patient. This enables the caregiver to monitor and make intelligent decisions about the patient's care. This includes ensuring that the patient does not exercise too much. Via mail and video calls, the healthcare provider supports the patient at a distance using virtual reality for rehabilitation. Healthcare providers are empowered to administer fast, temporary, and tailor-made support at a distance. For example, the provider can alter a treatment plan based on the review of the heart and respiratory rate and other relevant data. The patient provides feedback on the use of virtual reality via online measurement scales that are sent via the telehealth platform. These questionnaires enhance the capabilities for personalizing the virtual reality of the needs of the patient.
One of the better examples of integration I've ever seen.
Cove Rehab is a home-facilitated virtual connected care solution to lower costs, achieve efficiencies, deliver better outcomes, and increase patient satisfaction.
So these are the results. 3/4 of patients slowly climb in their daily activities, their condition, but also in their cognitive and mental status. However, we also elaborated on PREMS, and so the patient experience, did a lot of interviews, and there was a huge diversity. It was from frustrating and tiring to motivational and fun. And actually this large diversity we cannot explain, let's say, by the variance you normally have in doing research. So, and what we discovered is that patients' values in this way somehow modulated their behavior and their experiences. And these values were not only, let's say, the known values that are to us, like health as a value, autonomy as a value, or privacy, but also the spatial comfort, social comfort, and sensory comfort. And you probably would say, well, Harry, this is normal in research, there's no such as, or in treatment, no such as a one-size-fits-all treatment. But let's say, unlike medication or other therapy, with VR as a technology, it mediates the value of the patients. And this is called value mediation. And what is value mediation? Value mediation is like it alters, it influences the perception, but also the actions of the patient when interacting with the technology the patient has. And to give you an example from the patients, one patient told that she was, during the COVID time, she mounted her headset and was isolated in a very nice world. And she told us that she was very ashamed and embarrassed that she was in this world, and she felt embarrassed towards her husband, because at that time it was already social distancing and you had to sit together with your family, and she said like, this is asocial behavior. There was another patient who benefited much from the VR, and he said, well, the benefit is also because the VR was not judging me, opposed to his physiotherapist. So his experience was that it was not a judging medium. Another patient told us that she became more healthier, but she became also more relevant for her family. She thought she was more relevant for her family because she now was able to explain better what her disabilities did to her life, to the family. And this is called technology mediation. And we can research that, we can capture that when you deal with a single technology like VR glasses. But what about if you combine this with integrated technologies? So you have multiple technologies, and all these technologies have their own impact and their own mediation effect. This will become very difficult. And maybe you have smartwatches and you measure your sleep, and probably sometime you had a good sleep, but you were convinced you had a bad sleep because the data on your smartwatch were saying you had a bad sleep. And then you feel tired the whole morning. And this is typically technology mediation. So what we figured out is that the VR is not equal to in-person physiotherapy. And last year on a presentation on pain management, I said VR is unlike a pill. And I'm wrong. I have to take that back. Because VR is like a pill. You need the right patient, you need the right prescription, and you need the right content. But this applies not to the current prescription of medication, but applies to the new prescription of my medication. And what do I mean with that? I take you to a new pharmacy. In the new pharmacy, before you get a medication prescribed, they first measure your pharmacogenetics. And then based on your pharmacokinetics, your individual print, based on that they will individualize your treatment and instantly print your medication. This is the future of new pharma. So what about, you have the pharma genome, the pharma phenome. So what about VR? Is there a VR genome? Is the next patient you are going to prescribe VR, do you know the susceptibility of this patient for, let's say, immersion, presence, and bodiness? And what about the VR phenome? Do we know, when we prescribe VR, what will the bodily reactions upon the VR? What will be the individual interactions with the VR world? And I think there is a third dimension of VR, which is not applicable to a medication, which is the VR context tone. And what do I mean with this? This is the social, the emotional factors. This is work. This is even weather that affects the use, the value, and also the efficacy of VR. So VR genome, VR phenome, VR context tone. And why not? According to the new pharma approach, we do research in, let's say, what is the diagnostic VR omics of a patient. So look at the VR genome, VR phenome, and the VR context tone. So dear audience, we researched a lot, and we reflected a lot on all our therapies that we do with VR, but there's still a lot to discover, and there's still a lot to know. And I think we need to accomplish with people, we are here to get the full picture and to know what we can do for VR for our next generation. I thank you very much.
Thank you for that entertaining and very informative talk.